is Dr. Bonnie Henry, BC's Provincial Health Officer. We're honored to be here on the territory of the Kwangin-speaking people of the Esquimalt and the Songhees First Nations. I wanted to thank everyone who participated last night. 11,000 people tuned into the virtual town hall hosted by the Northern Health Authority, our fourth one out of 5. It was co-hosted by MLAs Doug Donaldson and Mike Bernier, and with CEO Kathy Ulrich and MHO, Dr. Raina Fumerton, who received and answered many thoughtful questions from the public. Tonight, for those of you who are living in interior health or are interested, they're hosting their virtual town hall with MLAs Norm Letnick and Katrina Conroy, Dr. Sue Pollock, the medical officer of health, the health officer there, and Susan Brown, the CEO of Interior Health. And you can get more information on the government website about that. I want to express my appreciation to my colleague in the legislature, Norm Letnick, the opposition health critic, who came up with this idea. We've worked together on this in an all-party effort, but I want to express a particular appreciation to Norm, who you can see tonight on the Interior Health Town Hall. And I wanted to say that we are not doing a briefing tomorrow, Friday at 3 o'clock. We'll be doing a briefing Saturday morning, and we'll have more information about that tomorrow. But that will be with Dr. Henry. And with that, for today's COVID-19 briefing, I wanted to introduce Dr. Bonnie Henry.
Thank you, and good afternoon. We'll start off with the number of new cases. We have 29 new test positive cases today, bringing our total of cases in British Columbia to 1,824. That includes 755 people in the Vancouver Coastal Health Region, 760 in Fraser Health Region, 111 on Vancouver Island, 156 in Interior Health Region, and 42 people in the Northern Health Region. In addition, we have one new long-term care facility outbreak, the Hawthorne Park and Orchard Manor in Interior Health, where there's a single case at the moment, and outbreak protocols have been implemented at that facility. We also have 2 new outbreaks in acute care units, in the Ridge Meadow Hospital and Lions Gate Hospital, and again, they are both being actively managed as outbreaks in those facilities. That brings us up to 347 cases in long-term care, assisted living, or acute care in the province, including 217 residents or patients and 130 staff. We have, on the positive side, 10 of the long-term care facility outbreaks now that had been declared over the past number of weeks are now declared over with no new cases for 2 incubation periods. In addition, we have another community outbreak. This again is in a poultry plant, the Superior Poultry Plant in Coquitlam, where 2 cases have been identified as positive so far, but there is an ongoing investigation that is happening as of yesterday when the first case was identified. So ongoing investigation and testing by Fraser Health. This is a sister plant to the United Poultry outbreak that had been announced earlier this week. And there continues to be an investigation at that plant with 29 people identified as COVID-19 positive associated with that outbreak. We are now at 78 cases of COVID-19 positive inmates and staff at the Mission Medium Institution, the Federal Correctional Institution, that we continue to work in collaboration with Fraser Health in the province and Correctional Services Canada to manage that very challenging outbreak, and that we expect to be ongoing for some time. Of our cases, 103 are in hospital currently, and of those, 44 are currently in critical care or ICU care. We have an additional 4 deaths to report in the past day, bringing our total of people who've died from COVID-19 in British Columbia to 94. That was 1 in the Fraser Health Region and 3 in Vancouver Coastal. And our condolences and our thoughts are with the families and the care providers and the communities who have lost these people. We have 1,092 people who have fully recovered as of today. We've been talking this week about, what does the future hold since we presented some of the modeling. And as we are seeing around the world and is becoming very clear to us, we are going to be living with COVID-19 in our communities for some time. And we need to develop our way of managing that and living with that. And we've seen some examples of that around the world as people are coming into the second phase. And when we think about the peak of our epidemic, that's sort of the halfway point. And in several places around the world, including here in Canada, we're at that or past that halfway point. We have been fortunate in many ways in British Columbia in that we have not had a dramatic increase, that accelerated upswing that we saw in many other places. And much of that is due to the way that British Columbians have responded together to keep their distance and to do the things that we need to do to try and manage this in our community here. And we need to continue to look at how we manage our pandemic in British Columbia. And we manage that risk going forward by opening up our industry, by opening up our hospital system, but doing it in a way that includes vigilance and careful thinking. And it doesn't mean that the virus is going away. So we have to learn how do we live with it without getting ourselves into trouble, without getting one of those explosive outbreaks in our province. We need to start doing that. We need to reach a manageable number of new cases. That doesn't mean that we have to have no cases every day for a number of weeks. We need to have a manageable number. We need to have a number that we can identify quickly, that we know people who are getting sick are getting tested, that we can manage your isolation of contacts so that people who have been exposed, if and when they become sick, get the care they need, but also do not pass it on to others. And we need to manage these clusters and outbreaks that we're finding in our communities. So that is our challenge, all of us, in the coming weeks, so that we can increase our contacts, we can increase our social connections, and we can increase our economic connections. It is a very careful balance, and it's going to be difficult for us to find that. But we also know that we can do this. We have had many essential industries that have continued, and we have put in place guidance to help us manage those industries in a way that protects both the people who are working, but also our families and our communities that we connect with. So it depends on us doing our part, even as we loosen restrictions in British Columbia. One of the examples that we have, we've developed an order, a public health order, that refers to, that provides direction for agriculture, aquaculture, forestry, and resources. And it includes how do we manage those industries, those important, essential things that we need in British Columbia in a way that protects all of us. And it includes guidance that will be posted in the coming hours, I think, as well as things like appointing an infection prevention and control coordinator for these important types of sites where we have people working and living in accommodations and common accommodations. We've learned from the outbreaks that we've seen. We've seen temporary foreign workers have experience with an outbreak of COVID-19. We've seen it in, most recently in the poultry plants. We've watched what's happened in other places, in northern Alberta, for example. So we are taking those learnings and we're applying them to our situation as we move forward here in British Columbia. And this is what we all need to think about. What does it mean for me, for my business, for my industry, for my sports? How do we as a family connect once we start having some leeway with restrictions? But we need to be very careful, and we need to be thoughtful about it, and we need to consider what we are doing and how it's going to impact our family carefully. A misstep in the wrong direction puts us all at risk, because we have seen how quickly this virus can take hold and can be transmitted and cause serious illness and hospitalizations and unfortunately deaths. So we need to think in the coming weeks about the widening our personal circles. We've been talking very much about how important it is for us to stay home, to have our connections be our family, our households, and to minimize those connections with people outside our households. As we expand our roles in the coming weeks, if we expand our circle, we have to do that thoughtfully, and we have to be aware of who in our circle is more at risk of having severe illness. So if I am going back to work, perhaps I need to be careful about who my children are going to go on a play date with. It may be more important that they spend time with their grandparents, that their grandparents are able to care for them when I'm going back to work. And it would mean not having that play date, because then you're exposing your child to the connections of those connections. So it's all complicated, but we need to think about this for our own family, and we need to make those judgments about what's important and how we can manage the risk for ourselves, but also for our community and for our province. And we will be providing more guidance, and I think we need to look at what we have done so far as examples of how we can do this safely. And we have a very limited room to do that. So those are the things that we'll be talking about more in the coming days, but I want people to think about it now and think about the impacts for our own families and our own communities. I also want to say that this is not forever. It is for now, and now may be months, it may be as long as a year, but there is a light at the end of that tunnel, and we have shown that we can do this. We have shown that in the last few months. We will get through this storm working together in the best and safest possible way. Now is not the time to tip the scales against us with careless action. It's the time for patience and for resilience, and to face our pandemic here in BC together, calmly and being kind to each other and staying safe.
Thank you very much, Dr. Henry, and I wanted to start by acknowledging the 4 people who have passed away in the last 24 hours from COVID-19. I think we say consistently, and I think for family members, of course, it's true, and for friends it's true, and for caregivers it's true, but it's true for all of us, that every single person affected by COVID-19 matters, and in particular those who've lost their lives from COVID-19, and we want to pass on to everyone our condolences and our thoughts in what has to be a difficult time. This is, as all of us know, a very difficult time to have grief, to mourn, and yet we have to find ways to do that and to support one another in the most difficult of times. And our hearts go out to everyone who's been affected today. As Dr. Henry has said, we now have 1,824 cases, 1,824 people who have tested positive for COVID-19 in British Columbia. That means that as we look at it slightly differently, 104 people, or 103 people, I should say, hospitalized in BC. That's the same number as yesterday, and it's down from a peak of 149. 53 of those people hospitalized in Fraser Health, 10 in Interior Health, 5 on Vancouver Island, 3 in Northern Health, 32 in the Vancouver Coastal Health Authority. If you look at the number of beds we have available, we have 4,180 beds available. I'm happy to say we had, not happy that there were ER visits, but happy that there's been a restoration of some ER visits. As you know, at the beginning of March, we were getting about 6,500 ER visits every day in BC. That number dropped below 3,000 around April 6th, and we've now had consecutive days where that's come in around 4,000, which means I believe that people who need healthcare services are starting to come back and get healthcare services in the way that they should in BC. I noted yesterday that we've also completed we've canceled approximately 14,000 surgeries that are elective surgeries in BC, or scheduled surgeries as they're more aptly called. We've also completed approximately 12,000 urgent surgeries, ones that with wait times, expected wait times of 2, 4, and 6 weeks for adults, those surgeries, and emergency surgeries that require surgery within 24 to 48 hours. We've done 12,000 of those. We recognize the challenge, though, as we look to reopen elective surgery, and that challenge includes people who require diagnostic testing, require screening. And so while we are in many ways still caught up on the question of urgent surgeries, that category of surgeries I talked about that has continued going on. We know that we will require, as part of our plan, to ensure issues around screening, particularly cancer screening, and diagnostic testing are resumed as well in a way that can protect especially the most affected patients. Dr. Henry has talked about the guidance and the provincial health orders with respect to a number of industries today, aquaculture and agriculture, forestry, including silviculture. These are important changes, and they reflect what we've been doing in BC, which is using public health orders with the leadership of Dr. Henry, with the leadership of the BC CDC, to allow people to continue to work safely. That is our goal, and I think in BC we've in fact kept significant economic activity that hasn't taken place elsewhere because we've pursued that policy aggressively. It requires responsibility on the part of employers and employees, responsibility that's going to be especially required in the period to come. So I wanted to express my appreciation to everyone, especially those in Dr. Henry's office, our medical health officers across BC, across the health authorities, those that work in public health, and the people at the BC CDC for all that they continue to do. As Dr. Henry has said, in the coming days and weeks, we're going to be talking about the changes, about perhaps a next phase in addressing COVID-19 in BC. But there are things that can't change. We have to continue to follow the orders and the guidance required to achieve what we need to achieve in this next period, which includes, it seems to me, continuing to stop the transmission of COVID-19. One, ensuring that people who are ill with something other than COVID-19 get the treatment they need. Two, including making sure our hospitals and our healthcare facilities aren't overwhelmed. Three, but also increasing economic activity and increasing the social activity we all need as social beings. And that work is something that will require us to work closely together. But it will be as difficult a period as the previous period. Hopefully we can be successful in achieving those goals while in this time, while ensuring that we continue to protect our seniors, while we continue to protect people who are vulnerable, as we continue to protect those in our society. So I wanted to say that shutting down COVID-19, the work we're doing, the work that we have to be 100% all in for, means opening up BC. One is a prerequisite for the other. Easing up on our efforts too soon makes it too easy for COVID-19, too easy for it to spread, too easy for it to claim more of our seniors and elders, and too easy for it to undo all of the sacrifice we've made together. We need to renew BC without rebooting the virus, and that is the work we have to do together. And it means together. What has happened over the last number of weeks, a relative flattening of the curve with the challenge that we've talked about in the last few days, but a relative flattening of the curve is a recognition of what everybody watching us today and everyone in BC has done. But we have to keep going. We have to keep being 100% all in. We have to do it for all of us, for the ones we love and the ones that we don't know. Aujourd'hui, nous annonçons 29 nouveaux cas pour un total de 1824 cas de COVID-19 en Colombie-Britannique. Nous sommes attristés d'annoncer 4 nouveaux décès liés au COVID-19 dans les régions de santé de Vancouver Coastal et Fraser, pour un total de 94 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches. Chaque région de santé, bien entendu la Colombie-Britannique, compte des patients atteints de COVID-19. 755 se trouvent à Vancouver Coastal, 760 à Fraser, 111 sur l'île de Vancouver, 156 dans l'intérieur et 42 au nord. Et, thank you very much. We're happy to take your questions.
Thank you. As a to everybody on the phone, please press *1 to enter the queue. You are limited to one question. Please unmute your phones. You're not audible until we call your name. First question today is from Richard Zussman, Global News.
Dr. Henry, is there any exception that allows support workers to enter hospitals with patients who live with disabilities who are nonverbal, no matter what the circumstance there? And if so, are there concerns that there are cases where these patients are being admitted with no support or way to communicate with the healthcare staff? And on a much less serious note, can you also make a comment about the Dr. Henry Fluvog shoes going on sale this afternoon?
Well, that is much less serious. I think it's a wonderful thing, and I'm really appreciative of the work that John Fluevog does in the community. And of course, he makes beautiful shoes, and it was an honor to partner with him to a good cause. We know that it's been challenging for many people during this crisis to access food, and food security has been even heightened for particularly for people who are no longer employed, who are homeless or underhoused. And so being able to support the food banks is something that's very important to me. In terms of people with disabilities who are having challenges in communicating in particular, I know that has been something that has been a concern for many people. There is exceptions to the restrictions that we have both for long-term care and in hospitals to ensure that people who have needs, extra needs around being able to verbalize or even other issues, not being able to communicate effectively or hear. So we do believe that there is accommodation being made. My expectation is there accommodation being made. It can be very difficult sometimes, and of course people need to wear appropriate personal protective equipment in that setting so that both the health care providers and the patients and the support people are protected.
Next question is from Binder Sajjan, CTV. Binder, is your phone on mute? Okay, moving on. Marcella Bernardo, News 1130.
Hi, Dr. Henry. I was hoping to ask you about the comment that you made a few moments ago regarding we're not going to have to go to zero case count in order to start lifting restrictions. But when we see comments made by people like the mayor of Las Vegas who's suggesting that it's okay to start coming back, what is it going to take for you to start actually lifting restrictions? What number can you put in your head or put in our head as to what it will take?
Yeah, I use that analogy specifically, and I think with some of the comments the mayor of Las Vegas made are very concerning. We don't have that approach here, and I don't expect to have that approach. But what we want is to be able to see a decrease. What we have done with leveling off our curve is we've spread it out somewhat. So it's not surprising to me that we're still seeing cases and we're still seeing transmission. So now is our time to really get on top of that, for people to be acutely aware if they're not feeling well and to get tested, to make sure that you're staying away from others when you're doing that. This is our time to try and bend that down, not just bend the curve and flatten it out, but now we need to get it. Obviously, I would like it to be zero for a number of days. That is the aim, the goal, and ideally zero for many weeks. But I do recognize that we have a little bit of room to play. Play's probably not the right room. We have a little bit of room to ease within that if we are able to do it safely. So things like making sure that businesses that open have the appropriate precautions in place, that we maintain our social distancing, our physical distancing from each other, that we don't start increasing our connections very dramatically, because we know that that's where this virus can take off. So having gatherings with lots of people, getting together with many different people outside our circles that we have put together for ourselves in the last few weeks is where we're going to see this virus catch fire and be able to take off again. So we need to gradually open things up, but keep those restrictions and be able to find people really quickly before it turns into a rapidly increasing outbreak. We're not there yet, as we can see by the fact that we're still having quite large outbreaks that we're discovering too late. So those are examples to us of how we need to do better to find people who are ill, to recognize it in ourselves, and to stay away from others and break those chains of transmission before we get those large clusters that can very quickly, as we've seen in many other places around the world, and more recently in places that had it fairly under control like Singapore, it can rapidly explode again. So we need to be vigilant, all of us, about that, and each of us doing our part about maintaining those physical distancing, washing our hands regularly, and critically important, recognizing and staying home if we're ill. and then connecting with us so we can get testing. So that's kind of a long way. 0 is the ideal, but we can manage as long as we're all doing our part.
Next question is from Tanya Fletcher, CBC.
Dr. Henry, regarding the new outbreaks you've announced today, can you elaborate a little more on how this new poultry cluster started? We know it was a sister company to the first one, but are staff working at multiple facilities? Does management travel between the sites? And just kind of on a secondary note, how concerning are the new acute care facility outbreaks? Do we know how those came about?
Regarding the second one, I don't have the details on the acute care facility outbreaks. I do understand that they are confined to single units in both cases and that there was an introduction. What I'm not clear is whether it's a staff person or a patient where the introduction came. I do know that the poultry one, yes, there's a sister company, and that there was some cross people working in both places, or at least some movement of people between both places. They are under a different management structure, and I know the investigation is ongoing, but it does look like there's likely to be others who are in the new facility as well who are also ill. Some of the challenges that we have on one of the new long-term care facility outbreaks is, these are the chains of transmission that we find. There was a person who returned from working in Coral Lake in Alberta, didn't recognize the symptoms in themselves, passed it on to a family member who worked at a long-term care home. So those are the things that happen that we all need to be aware about. It may seem like nothing, but even one extra connection can lead to an introduction in an environment where others will get sick as well.
Next question is from Rob Shaw, Vancouver Sun.
Thousands of British Columbians are going to rush out as soon as they can and try to get their hair cut, the nails done, a lot of personal grooming in the weeks ahead whenever they can. And I was surprised to learn that entire sector of personal services was deregulated by the previous government in 2003. So it's the hairstylists and nail salons, spas, waxing, microblading, laser skin treatments. There's no standards for hygiene, for sterilization, for how often to wash equipment or gowns. There's no accreditation from a body. And it seems to represent a risk for the potential for some type of transmission or outbreaks in a huge sector of the economy. And I wondered if you are hearing any calls to re-regulate this sector, or at the very least force them to undertake some sort of mandatory, they have an online beauty safe course that's similar to food safe so that there are standardized hygiene, or if you see that even as a risk at all in the weeks ahead.
Yeah, so personal service settings or personal service establishments is something that I and others have been involved with in public health for a long time. There are infection prevention and control guidance that we have for personal service establishments, so it's not quite a free-for-all. There are quite detailed guidance that people need to do. The Beauty Safe online course is one of them, and I was involved in actually setting that up a few years ago, along with a number of other people from industry and from others. So yes, there is some oversight from local public health of personal service settings. Much of them now, given the way that things have evolved in the last few years, are complaint-based. So this is an opportunity for us to reinforce the importance of some of those measures in whether it's a hair salon, a nail salon, a tattoo parlor, all of those places where we get services that can pose a risk of infectious disease transmission. So I think it is an opportunity for heightening awareness across that sector, but they will also have to put in place the measures that we need to prevent transmission of this respiratory virus, COVID-19. So that's over and above the other infection control measures that need to be in place in these facilities or in these premises. So yes, I think it's a good opportunity to reinforce the importance of all of the infection control measures that we have, so that we're not spreading bloodborne pathogens. You know, much of this came out of concerns about HIV and hepatitis and other bloodborne pathogens, skin infections and other things. So there is quite a strong support from public health for these types of premises. I have not considered whether we should take this opportunity to look at regulation again, but I do think it is important in the context that we're moving into that we do put in extra precautions that meet our needs to prevent transmission of COVID-19. Yeah.
Again, as you know, I think the Act, it was the Barbers Act, was one of the oldest acts in BC. It had been around for quite a long time, and there was a deregulation at that time, and the Act was rescinded. But I would say this, that what Dr. Henry is talking about is what everybody is going to have to look at. How do we make adjustments, both to rebuild public confidence, because that will be an important fact, and to ensure there's public confidence to go to establishments should they be allowed to operate in those ways, but also start to do the work now to ensure that it can be done safely. And this is required and will be required across BC society and across the economy. And so there's an issue, and it's important, of the public having confidence, and that will be important for the industry. And the industry will have to see that. There has been a live debate for a number of years within that industry as to what the regulation of that industry should be. But this is an opportunity for that industry to come together, perhaps to raise standards, but what will be required at the very minimum is to meet the standard being put in place by the provincial health officer, which would be the minimum required to start over again. So whether that would require new legislation, I don't know, but with health orders such as we have in place, it will require a dramatic change in the way people operate.
Next question is from Melanie Nagy, CTV.
Dr. Henry, I've had a couple of the same question come into me from Twitter from folks asking about home care support. We know nurses, home care support workers going home to homes to take care of our seniors or those with needs in home care, and people wondering about what safety or mechanisms are in place. When we talk about long-term care, people not going back and forth between facilities, but then we have workers, say, going between different homes. Can you just talk to some about the safety measures and how staff and seniors in those home care supports are being taken care of?
Yeah, so it is a slightly different setting. We don't have a congregate setting in a home. So there are guidance that we've provided for home support and for home care, so nurses that go into the home to provide support as well. And it involves things like minimizing the people in the room. If you are doing, it depends on what support you're doing in the home. If you can do it in the room when the person's not in that room, that helps. If others in the family are, if you have to provide direct support, making sure you have the appropriate tools to do it safely, making sure you can clean your hands, that you can wear gloves if necessary, and masks if necessary. But also recognizing that we don't want you having contact with all the other family members that might be in the home. So there's things that people are doing around that. And it is a different scenario when you're going into an individual home. It's a little bit more controlled rather than a long-term care environment where there's lots of quite vulnerable people living in the same environment. But it is recognized to be a challenging thing.